Hi, my name is Sunny Patel. I'm a board-certified pediatrician here at Community Health Center of the North Country in Ogdensburg. I'm originally from Montreal, Canada. I recently moved back to the North Country. We were previously living in Florida, where I was working as a pediatrician as well. I did my medical training at American University of the Caribbean. From there, I moved on to Long Island, New York, where I did my pediatric residency. Following that, I decided to move back to Messina, where I worked for 3 years. From there, that's where I ended up going back to Florida to spend some time there, ultimately coming back to the North Country and here to stay now. This really does feel like some type of homecoming for me, as I've already lived in the area, and coming back here does feel like I'm coming back home. I knew I wanted to become a pediatrician back when I was in early college. I took on a summer job as a day camp monitor. From there, I ended up doing that for several summers in a row. That's where I really, got the understanding that I think this is what I want to do. Some form of working with children, interacting with kids, helping kids in whatever way they needed it. I also had a passion for medicine at the time, so it just seemed natural that I had to go into pediatrics, where I could combine both of them into one. So that's kind of how I know and always knew that I wanted to become a pediatrician. What I find most fulfilling working with kids in the office is really just developing a relationship with them over the many years that I intend to see them. It's hard coming into the doctor's office. I think my goal is always to make kids feel like this is a fun spot to come to. It's not like going to the doctor's office. They're just coming to see a friend, and I want them to be excited to come to the office. And that's when I get to that point with a patient, that's usually when I feel the happiest. With parents, I always strive to make sure that they feel just as comfortable talking to me about any problem that they have with their child. It is hard to get people to listen to you, and I always strive to make sure that you always feel like your voice is heard. In addition to that, I like to incorporate parents with the medical decision making of their child, and we both come to some form of treatment plan that works for them and works for us. So that's kind of what I love to do. I chose to work in the North Country for many different reasons, on a personal level and on a professional level. On a personal level, as you know, I'm from Montreal, Canada. We recently had a baby who is now 4 months old, and as every parent knows, it's very difficult raising a child. So we wanted to be as close as possible to family, and this was the perfect setup for us to be close to family. On a professional level, I chose to work in a rural community because I know families truly value their care. I also feel that I can make a meaningful difference here where it's needed most. When parents choose to bring their child here for care, they can expect an atmosphere that's very comfortable, open, and somewhere where their voice can be heard. This is something that I find extremely important as a parent, that you should always feel that you can advocate for your child, and I hope that I can advocate for them as well. So this is something that they can expect at every visit when they come see me. Outside of the health center, I enjoy spending time with my wife, with my new baby who's 4 months old. I'm also a huge car guy, as you can tell. That's probably where 90% of my time goes. I'm a Canadian, so I obviously love hockey. And I also enjoy gardening, planting, lots of do-it-yourself things at home. And that's pretty much what I like to do. So again, my family and I are very excited to be back in the North Country. I'm looking forward to meeting you and providing care for your families. I am accepting new patients now. Hope to see you soon.